Hi, my name is Nina Dominguez, and my project is exploring the impact of flower gifting on psychological distress and physical recovery in adult patients undergoing physical rehabilitation. So on the agenda for today, I'll be going over my problem statement, my background, and kind of like the context of my whole project, then my hypothesis and research question, the description of my method along with a short version of my procedures, findings and analysis like this far in the process because I haven't fully finished that, and the reflection and implications of also what I've already noticed and like what I hope to see with my data. So in existing studies in the body of literature that I noticed when performing my lib review was that a lot of the studies had to do with like hospital setting. So like horticulture, which is just like the study of like plants and like flowers, but like in a setting environment. So putting them like on a table or in a hospital room, but not so much the act of gifting or like in an active exchange. They also neglected physical recovery as a whole, and they were all mainly on like mental health or how to improve psychological state, which is also a key aspect of my study. And they, again, like I said, highlight solely mental health benefits. And they're also on general nature-based interventions where my project is solely on flowers and various kinds and not the idea of the plants. So because of this, there's limited research on how flowers can ease psychological distress, and then most importantly, can those lower distress levels lead to better rehabilitation outcomes? And I'll define what I mean by better outcomes, but below in the visual, you can see kind of the process of what the question is kind of like, where they would receive an intervention and then possibly see how this affects their mental state and then see if their recovery aligns with that. So something for you to know should be that more than 14 million people in the United States receive physical therapy in 2020 alone, according to the physical therapy workforce analysis, which is really important to highlight because, as I'll be further discussing, that physical therapy is one of the most mental strenuous activities that you can do because of like the loss of hope, especially for, let's say, athletes that are really passionate about their sport and then they automatically just can't do anything anymore or working towards to get better. It can be really tough on the mind, even on someone that's like maybe elderly, which is mainly the population that I'm sticking with, an 18 plus population, which was a delimitation that I want to mention that I made myself because the NIH, the National Institute of Health, states that there's vulnerability in this older demographic because they're experiencing those later signs of mental decline. So this just shows and highlights like the prevalence of the problem. 3 foundational studies that helped me arrive to my project were Origins Therapeutic Impact of Nature, which deals with the natural elements alleviating mental distress, kind of that I touched on before about like the hospital setting and just being around an environment with plants. Another one from Wolf, which is the perceptions of hope and how it informs interactions with patients. And this study kind of just goes over the importance and like how crucial it is to have a staff member and like their relationship with the patient, whether it be in the medical field, which is kind of where my position is, or just like even like a teacher to student relationship, like just how much that actually affects the outcome of what's at hand. And then the last study being Emotional Well-Being and Recovery by Griffiths, which states that emotional support is critical in recovery, especially after injuries, which also just further explains what I said about if it's an athlete or something, it's more strenuous than most people would believe. And all in all, it made me come to the conclusion that there's a need for further exploration of something that's realistic, so simple, low cost, emotional interventions that can aid mental health and maybe even physical health. So this led me to my research question and my hypothesis, which ended up being what is the impact of receiving flowers on psychological distress and physical recovery of adult patients in a physical rehabilitation setting, and how might improvements in distress influence recovery outcomes. And my hypothesis is in the form of a visual picture that I already put in a previous slide, because I believe that the floral intervention will lead to better mental health, and then this betterment of mental health will lead to better patient outcomes. So I chose to use a longitudinal experimental study with 3 groups. So I have 12 patients in total, divided into 3 groups with 4 people in each group. In group 1, the patients would be receiving flowers just once a week. In group 2, they would be receiving flowers bi-weekly, so twice. And in the control group, they wouldn't be receiving flowers at all. And they would all be going to therapy just twice a week. So they all have the same schedule to eliminate bias or anything. The data collection was mixed methods because I felt that to get a holistic view, I would have to examine how patients felt personally, how the therapist felt about seeing them, which I feel like you can't necessarily like derive just from numbers. And brief procedures. So obviously before conducting anything, I needed to make sure that my consent forms were in place to make sure that all my ethical considerations were understood. And in those consent forms, it was highlighted that they would have to be using these 2 scales, but they had no idea really what the correlation of the project was, and that there might be an intervention involved, but nothing about the flowers, so they wouldn't know what was affecting them if it ended up affecting them.
That's fine.
Yeah. And then also for the first, this was a 5-week project, as it's in the longitudinal experiment. So for the first 2 weeks, they were all the patients were receiving a POMS scale, which is a profile of mood states test. And this was a 65-item questionnaire with 5 negative scales, 1 being tension, another being depression, anger, fatigue, and confusion, and then 1 positive affect scale of vigor. And there was also another scale called the SPVB, which is the Short Physical Performance Battery, and that's an objective assessment tool for evaluating functioning in adults specifically, which is relevant to my population. So for the first 2 weeks, like I said, they would all be taking the POMS to be able to get an average of the 2 days of their mood. So that way, before I brought in the intervention for not the control groups, I would be able to get an understanding of their baseline state to make sure that nothing else was affecting them. And then after those 2 weeks, from 3 to 5, they were beginning their intervention period. So like I said, group 1 just once a week on 2 of the sessions, and then the other group would get it on both days of the session, and then the control group would just go about their 2-day-a-week schedule as normal. And then in those assessments, after the assessment, they would fill out the profile of mood states again after the intervention, and then the physical therapist would fill out the short performance battery to be able to understand their physical state without the effect of their mental well-being, which is really just an equivalent of something that they would fill out on their own just to check up on how they're doing. And also in the SPB, I included a section that was qualitative, so that way the therapist could put their own observations, like if they saw the patient experiencing more time with the flowers, if they saw, because part of it was a 5-minute gap period after they would receive the intervention to make sure that they're like fully they're fully getting the effects of the flowers. That was like a requirement. So for if any reason the patients happened to stay with them longer, or they were observed doing something specific, that was something that they would know. And after all of this, if I saw an outlier in the quantitative data, then I pulled those people out to perform further interviews that I justified with another one of my studies. And for example, after noticing that I had 2 outliers in groups 2 and 3, I noticed that in group 2, one of the patients had a family visit, which might be like an external factor that could be further explored. And another patient had a severe injury compared to everyone with a knee replacement that had gone on. So I feel like that was really important, and just overall, again, just gave me a holistic approach to my research. So here's an example of the bouquets that they were getting. This was week 1, 2, and 3. And you can see that they're all in a variety, which was also something that I did on my own to avoid bias of a specific type of flower or colors or scents, anything that could affect the research. So again, these are my findings and analysis just thus far in the process, so I haven't fully analyzed everything with my expert advisor. And initially, I feel like it's important to know that I was gonna pursue like a more of a correlational statistical approach, but I realized that in the health field, most of the studies were actually using t-tests to compare like 2 different variables. And speaking with my expert advisor, that just made more sense with the type of data that I'd collected, because I'd collected averages of 2 days. So here there's just a picture of the data thus far that's been put into a t-test, and this was from the profile of mood states. And through this, so far, I've noticed that the group with 2 repetitions had a significant difference from the control group. So not so much the group that got the flowers once a week, but there was a really drastic difference in twice a week, which leads me to believe that in the future, people should explore repetition as something that could really make a difference. So again, the data presents so far a positive correlation, not correlationally statistical, but just a correlation between like the flowers of the repetition twice a week, and then so far in just what I've seen in numbers, the recovery scores align with the mood states. And then the outliers, as I also revealed, was the severity of the injury, and then family support were what I have collected so far in the qualitative section that was significant.
Your t-tests were in that last, if you go back.
Yes. Oh, how do I go back?
You just swipe backwards.
Oh.
The last row, right?
Oh yeah, actually, I forgot to mention that, but the p-value here from the control was below 0.5, so.
Okay, and that's because t-tests, you have to compare the 2 groups. So you did 2 and 1?
Yeah, I compared the 3 groups because this was, the 1s are just for the 1 group, the 2 was for the twice a week group, and then
the control was
the
0.
control's supposed to be group 3, but it says 0 because they were 0 intervention.
Okay.
And then, so far, what I've collected from my reflection is that this whole project did improve psychological distress and increase physical recovery because of the psychological distress, especially by repetitive action. Because in numbers alone, I could see that there was a difference in group 1. Like group 1 did have a slightly better psychological to physical. It just wasn't statistically significant because my population size is also a little smaller. So if it was bigger, it might have been, which also could be further explored. And it's
you had the 1 outlier, right, in group 1?
In group 2, but it was because of the severity of the knee injury, and the other ones were more just like general physical therapy, as opposed to like something that they were like there for because of an injury. If that makes sense.
Yeah.
And then so this did support the integration of emotional support in rehabilitation, and then implications are that future research could explore diverse populations, possibly, because that's not really something I took note of in the qualitative section. Other low-cost interventions, because overall it was pretty effective, and it was also non-invasive compared to other mental health boosting interventions like nerve stimulation or even behavioral therapy that people might not want to seek someone. And I think something else that could be explored is specific injuries because of the knee injury, like maybe something that's not so like strenuous, and family dynamics, like maybe having people that have more support than others and seeing if that's like crucial and getting better.
Okay, I kind of wish I had a pen because I feel like I had things that I could write down.
Oh,
but yeah, it's okay. But I think that was really informative. It was just kind of a lot. So I think that especially in the slide that was talking about like the brief procedures.
Oh, okay.
Yeah, I think you talked on that one a lot. So maybe you could split that into a different slide.
Or like a few, like kind of.
Yeah, like because if you're gonna talk a lot about something, especially when you have all those points that are like summaries, and then you like talk about the summaries, I feel like you could maybe add another slide. I don't know if you're like have a slide limit or not.
No.
Okay, so if you add more slides about those procedures, since you said so much about them, I feel like they're important. Especially since it's like a complicated
and there's like a lot
study.
of variables because there's like
exactly.
both tests.
Yeah, exactly. So I think if you like wrote a little bit more about each one on a slide, then it might be easier for whoever's listening to follow along.
Okay.
Yeah, and then the rest I think was good. So then, let's see. Is funder support a key to the success of your project?
Well, I think it's like important in ensuring that like the project could reach like its full potential, because obviously like it's not necessarily something that needs money like directly and now, but if it did have those funds, then everything could just be like executed at a higher level, faster pace, and just it could also just limit the time that therapists need to spend like documenting. Like I feel like I could implement other ways to just make it more efficient.
Okay, so they were already doing like the POM it was?
The POMS, yes.
POMS and then the SPB, PPB. Okay, and one was just for like their physical state and one was for their mental state?
Yeah, because I wanted to isolate the 2 variables to make sure that they weren't like crossing, because there's a lot of tests I found like when trying to pick them that had a qualitative section, but I kind of wanted to avoid that because I didn't want like the the person that was because the patients are the ones filling out the mood state, just so that way them alone can like, because I feel like the best person that can analyze that is like yourself.
Yeah.
And then the best person to analyze like your physical state would be like someone else, because like you don't really have control over like thinking about like how well you're actually doing.
Mm-hmm. So then for the physical state, you were saying like only one person had the knee injury that was like the most severe type of injury there? Or
Yes.
everyone else kind of had like less severe injuries?
Yeah, well, there was like some people that had, I know someone had like a wrist fracture, something like that, which also like I would consider like kind of on the same level,
Mm-hmm.
but definitely like that patient was experiencing like an abnormal amount of pain, so obviously like the injury was just like higher, I guess like a little higher like stakes for them.
Mm-hmm.
Which was like definitely noted by the therapist, because also I forgot to mention this, but another like way that I eliminated bias was by having the therapist like be the same for everyone. So like the way that they were documenting things, like it was the same thought process behind like jotting down like things that they thought were important, and also just so that way like the way that they would come across with different patients was like more or less the same.
Okay, yeah.
Instead of having maybe like a male versus female therapist.
Okay, nice. So then they would do, like the therapist would write down things that they noticed, and that was the qualitative aspect?
Yes, and also because they had that 5-minute wait period.
You're good. You just have to.
Yeah. Because they had the 5-minute wait period, I thought it was important to like make sure, because I can't really control about how much time is there since I'm not like actively there.
Mm-hmm.
So like by having them like be able to note things down, like especially like in that time frame, just like made me sure that like maybe some patients were with the flowers more than others,
Mm-hmm.
versus like me just thinking that they were there for 5 minutes, but they actually didn't like sit with them for 5 minutes.
Oh, okay, so they would sit with them for the 5-minute gap period.
Because they needed to be like with the stimulus like enough of a time that it would be able to like even have an effect.
Would they like talk with them too?
That's not something I raised. Oh, actually, there was some observations that I did make that said that they were like overly enthusiastic, or that they showed their appreciation and gratitude for the flowers. So that was like part of the mental part
Mm-hmm.
that I also took into account.
Okay, cool. So, kind of same question as before, but what is the opportunity cost of not funding the project at this time?
Well, I feel like it would just significantly like enhance like the product's quality. Maybe like, well, you saw the flowers that I was able to pick, but if I could maybe get like a more like just like a bigger, more like fulfilling thing to give like for the variable, just considering like how important that was in my project, like I feel like maybe that could make a difference, like I don't know, and eliminating some of the things that I saw,
Mm-hmm.
but I'm not sure.
Would you want to like improve the schedule of like receiving the flowers too? Because you mentioned that you noticed that getting repeated flowers like a week, like 2 times a week, seemed to be better than getting it once.
I definitely think like if I did it again, or if I had more time, then I'd probably do like minimum 2 times a week, and then 3 times a week, maybe 4 times a week, and then have the control group still, just to be able to like account for if that even had an effect.
I think that makes sense too, because it's I feel like you separate the week, you kind of reset every week. So if you're getting flowers twice a week, then you're like, whoa, this is really special, you know?
And
So
also like because it was only 12 participants, I feel that like if I had more time, maybe like with a little bit bigger of a population, then it like would have given me like slightly more accurate results. But also analyzing the scores and stuff, like I couldn't use like computer tools or any like type of analysis, because that kind of gets messed up. So that I feel like that was kind of not a limitation, but just kind of something that like hindered me from like using more people, because of the time that it takes to look at all of those marks. Yeah.
Okay. What's your plan to create awareness or promote your project?
I guess it could be promoted like with physical therapies, and like physical therapy centers and their programs where like staffs could help recruit patients. Actually, especially like when I started this project, when I had to find a person as like the owner or whatever, like when I like pitched the idea to them at the beginning, they were really excited. So because they mentioned like how patient-centered care is super important, and like how they wish there was more of that, because it's kind of hard to do it in like an ethical way that doesn't really interfere, which is like what I said earlier about like the nerve stimulation and like the cognitive therapy, because that's just a little more intense.
Yeah.
So something like this is just like less invasive, less like low cost. So I feel like if it was able to like be pitched to like more people like that, then it would be like really realistic and effective.
is funder support key to the success of your project?
I don't think it's key, because I think if someone wants to like have this happen, like it's definitely doable, especially like that those centers are on a larger scale, so they definitely could take a part of it if that's something that they're like centered around, like the patient care, then they definitely like could set something aside to do things like this. But funder support again like would just like let it like get to like the highest level of like doing like arrangements that are like really impressive and just getting it to like the best of its ability.
Yeah, okay, that's a good point, because I would like to see maybe the effect of the type of arrangement too, to see like, oh, if they got a bigger...
Because these are a little more like humble.
Yeah, they're cute though.
Yeah.
Like I feel like I would be like touched too.
On Valentine's Day, some of the bows are red, so it's like...
Oh, nice. Yeah, I saw the picture
Yeah.
with the red ones. I was also wondering, like, does the color of the... I don't think there's that much, or if there's that much research on like how color affects your mood.
That
Does
was
the
something
color...
I found in my lit review, so I guess that could be like an implication, like someone could look into that, but it didn't really like correlate with like the results of what I found, just because I did like mixed things instead of doing like red, yellow.
Yeah.
But it could be further explored.
Yeah, because the only thing I would say with that is that if it is an aspect that could affect like their mood, then maybe you could next time keep everything the same, like throughout the whole experiment.
Or like
you know?
do it with different colors. Yeah.
Yeah, like keep the colors and the type of flower as the same, to see if it's just the flowers, or maybe because it could be that maybe one week you brought flowers that they were their favorite, and they're like, oh my gosh, these are my favorite. Like,
yeah. Well, there's also a study about like roses in particular being like associated with like romance and like just like feelings of like importance like when they receive those.
Oh yeah.
But like just to like keep it kind of more narrow, because I already had a lot of factors, I just like did arrangements of like a few different kinds.
Okay, cool. Yeah, like more general flowers.
Yeah.
That works. Okay. Okay. My last question is, what have others done in the field to date regarding this need and target population?
I feel like people have been able to identify that for sure, like physical therapy and like getting her, even like a patient in a hospital room, like the study that I mentioned before. Like I feel like there's obviously like there's been seen that there's a need for a way to improve like a patient's state, especially just because like even like in the hospital, like it's so like dark and like dull that like you kind of need those like sweet little things. And then in physical therapy, there's just like a lack of that, because it's more of like a niche like field than like a hospital. But like there's like other settings I've thought of, like this could be done into like in like maybe like occupational therapy to just like smaller like fields of medicine that could just help it. So they definitely recognize that like there's a problem with psychological distress, but I feel like no one's really implemented like an effective way that's kind of like personal, because it's usually like through foundations like Make-A-Wish or like little clubs or nonprofits that try to help people like with these things, but not necessarily something that like they themselves do that's like ethical and like can actually push forward.
Okay. Cool, that's it then.
Okay, thank you.
Thank you.